Hello all, welcome to Pharmanandan. Right? In this video, we are going to discuss gout, gouty arthritis and its pharmacotherapy. This is part 1 of gouty arthritis. Okay? What is gouty arthritis? It is crystal induced arthritis and it is a true crystal deposition disease. Site is MTP joints in the lower limbs, right? Most commonly in the lower limbs. What is this crystal? The crystals which form the gout. What are those crystals? Those crystals are monosodium uric acid crystals. Okay, these monosodium uric acid crystals, when we extract through needle in pathology and we put it in polarized light microscopy, we can appreciate them. Polarized light microscopy, we can see these crystals. Who are affected more, men or women? Men are affected more for with this gout. If we take five men are affected with gout, we can see one female is affected with gout. Men are more affected with gout. Okay, and this gout is of two types of presentations. Acute gout, it comes as an attack. Okay, we call it as acute gout attack. How is that attack? That attack is of sudden onset, okay, during early morning hours. And does it progress? Yes. How does it progress? It progress rapidly. Okay, rapid progression, sudden onset. This is the nature of acute gout attack. Okay, coming to the chronic gout. How does chronic gout will be there? In chronic gout, the main thing which we can see is tophi. These tophi are needle-like structures which can be seen in radiography. These are appreciated in radiography. Tophi. Okay. This monosodium uric acid crystals, we said, right? This is the gout is due to accumulation of monosodium uric acid crystals, right? How does this uric acid crystals are accumulated in the lower limb? What is this uric acid basically? What is this uric acid in human beings? What is this uric acid? This uric acid is the final step, that is the end product we see. What is the end product we see in the catabolic pathway of purines? That is uric acid. So uric acid is the final step which we see during the catabolic pathway of purines, right? Where does this uric acid is pooled in the body? For example, if I take entire body uric acid, if I consider it as a pool, in swimming pool, water keeps on entering and water keeps on draining, right? How does this uric acid get entering into the body pool overall? Okay, 1/3 of this body entire uric acid pool is derived from diet we eat. Okay, this 2/3 is, yes, we discussed just few minutes back, it is due to endogenous purine metabolism, that is the end product in purine metabolism is uric acid. Okay, how is it eliminated from the body? It is eliminated from the body by two ways. 1/3 is eliminated through GIT. How about the rest of 2/3? The rest 2/3 of the uric acid in the body pool which is to be eliminated, those activities taken care by, yes, kidneys. So by now you understood, right, how gout occurs, what is the main pathophysiology of the gout, which are what are the causative things which causes gout. When there is excessive dietary intake of the purines, which leads to over pooling of body uric acid, or when there is excessive purine metabolism leading to pooling of uric acid, or when there is poor elimination by the kidney, when there is some pathology lying inside the kidney. This is the appearance of the gout. This is the lower limb and this is the MTP joint. We can see here small needle-like structures, right? These needle-like structures are uric acid crystals, right? What are the aims of treatment of this gouty arthritis? Our first aim is, yes, our first aim is to decrease the symptoms of an acute attack. Okay, to decrease the symptoms of acute attack. In the image you can see ice packs, right? Ice packs give somewhat relief. We are discussing pharmacotherapy. And the second aim in treating gouty arthritis is we have to decrease the symptoms of acute attack as first aim. The second aim is to decrease the risk of recurrent attacks. And what is the final aim in treating gouty arthritis? Our third aim is to lower serum uric acid levels. Okay, serum uric acid levels should be lowered. Okay, and what are the drug list in the gout which we use for the gouty arthritis treatment? The first group of drug is our main aim. The first aim is to relieve the inflammation and pain. Okay, to relieve inflammation and pain. What are the group of drugs which we use for relieving inflammation and pain? First group of drug is NSAIDs and second drug is colchicine. Colchicine gives dramatic improvement in pain relief of acute gout. Okay, and steroids are also used to relieve inflammation in pain. Steroids are used as per oral also, that is as tablet. What is the tablet? Prednisone tablet is used. The dose will be of around 30 mg to 40 mg, okay, per day. The main thing which we should remember about this steroid prednisone gout treatment is these dose should be in tapering manner, and this steroid can be given as injection also, where we inject the steroid. We can directly inject steroid into the joint. Okay, and the second group of drugs is xanthine oxidase. It is an enzyme. This enzyme can be inhibited, okay, through some group of drugs. What are those group of drugs? Allopurinol and febuxostat. The name itself indicates that this febuxostat xanthine oxidase is inhibited. Stat. Okay. What is our aim here? Our aim is to inhibit uric acid synthesis through xanthine oxidase inhibitors. What is the third group of drugs? Uricases. Uricase. Okay, it is naturally an enzyme. We prepared synthetic enzymes through recombinant technology. Okay, examples are pegloticase. And another example is rasburicase. And next group of drugs is uricosuric drugs. Okay, uricosuric. uric drugs, uricose uric drugs. Name itself mentions that these drugs will try to eliminate excessive uric acid in the body. Okay, what are the examples of these uricosuric drugs? Most popular example we all know is probenecid. And other group of other examples of drugs is lesinurad, dotinurad, and losartan is also having a property of uricosuric nature. So losartan is also used in gout. Mechanism of action is uricosuric nature. And is there any off-label drugs used in the treatment of gout? Yes, off-label agents are also there which are used for the treatment of gout. Okay, off it. What are those off-label agents? Fenofibrate, anakinra. Anakinra is, yes, interleukin 1 antagonist. Okay, and is there any monoclonal antibody? Yes, there is one monoclonal antibody, canakinumab. These three are off-label agents used in the treatment of gout, right? In the next video, we will discuss in detail the nature, that is, these properties of these drugs and pharmacotherapy proper of the gouty arthritis, right? Meanwhile, you can comment below in the comment section the answer for this question. What is the additional property of etodolac, that is an NSAID which is used in the treatment of gout as an NSAID, right? But this etodolac has one more property apart from NSAID nature which is helping in the treatment of gout. What is that additional property of etodolac? Comment below your answer in the comment box, right? And see you again in next video regarding the next portion of the treatment of gout. For any queries, please write an email to farmanandan at the rate of zohomail.in. Okay, thank you for watching and see you soon in next video regarding the other part of the gouty arthritis treatment. Thank you.